I have been practicing for almost 5 years. I started in July of 2016. I just graduated residency, and the next week I started working here at Dentistry Just for Kids and TK Orthodontics. Honest truth, I didn't really decide to practice with a pediatric dentist. It was in an area where I really wanted to live, and it looked like a good opportunity that could grow. And so that's really why I partnered with a pediatric dentist at first. Well, from a business perspective, there's a lot. We get internal referrals quite often. One of the big things is you obviously want patient flow coming in. And so the pediatric side, we've got 2 to 3 pediatric dentists working at any period of time, and so that's a lot of patients that are coming in that they can just funnel directly to me, so that's very helpful. From a business side also, we have really good pediatric dentists. Dr. Steve, my partner, Dr. J, my associate, some of the other ones we've had in the past. The community really trusts them. They do a great job with the patients. They're excellent dentists, and so the parents trust what they say, so the parents are more likely to come see me then if Dr. Steve or Dr. Jamie says you need to go see the orthodontist. Not only that, they trust my treatment plans more. So if I feel I need to take out teeth due to crowding or something like that, they're more apt to say, yes, I trust what you say, and we'll go get it done. So from a business standpoint, it makes a lot of sense. Okay, so the advantages of the pediatric ortho practice from a patient and orthodontist side are significant. First off, we kind of talked already about the internal referrals, but it's not just internal referrals, it's same day referrals. Quite often on the pediatric side, they'll see a crossbite same day, send them right over to me. We'll get our images real quickly, and then we can discuss that with the parent. So for the parents, it's one-stop shopping, but it's also a direct referral where they don't have to spend much time, going to this place or that place to have to talk to different doctors. Hygiene, much easier to get a control over it. We've got our hygienist looking at the patient. They do the same appointment as a adjustment. So you've got me and my assistants talking to the parents about hygiene. You've got the hygienist talking about it. We've got our fluoride treatments going on. All of that's working. We're getting images. We can take the wires out. They can look for cavities. Some other things that I've really enjoyed was, let's say we have to take out teeth. I can see the patient take the wire out as opposed to leaving a sectional wire in, something like that. They then go get their teeth taken out, come right back to me, and I start closing space immediately, which we can get that space closed faster. There's no dilly-dallying around hoping that the general dentist takes the teeth out or agrees or disagrees with your plan. We got a lot of small lateral incisors. Sometimes we need those built up. I take off the bracket. They go see Dr. Steve. He puts on an amazing restoration on that lateral. Then they come right back to me. I put the bracket right back on. Tooth doesn't move at all. And then we just keep moving forward with treatment. So that's a pretty big advantage, not just for us as the orthodontist, but also for the patient because they're not having to go to multiple appointments. They know the cost right away. We can show them all of that stuff. So I really like that aspect of it. I think one of the big disadvantages is you're not getting a ton of external referrals from general dentists. Now I do have about 3 general dentists that refer to me quite often, 2 of which live pretty far away and their practices are pretty far away, so they're not that worried about competition. But I do think a lot of people get concerned about the competition and the patients not going back to the general dentist, which we encourage them to go back to their general dentist for cleanings and things. But that is one of the problems. But I would also say across the board, we know that in the past couple decades, referrals are going down the way I understand it. And so it's not the end of the world that I'm also not getting those referrals. One other thing I would say is that most pediatric practices have a younger clientele. Our practice has got much more mature clientele, so we still get a lot of 12, 14-year-olders coming to the pediatric dentist, but a lot of places are seeing 8-year-olds, and those aren't your bread and butter patients, so that's also a disadvantage. Okay, So let's just say you're an orthodontist and pediatric dentist and you're just out of school and you're wanting to partner together. As an orthodontist, you got to understand that you're not going to be getting patients right away. They've got to build up their, patient base before you get any. And the other thing you've got to remember, we've touched on this earlier, was that a lot of pediatric doctors see younger patients. And so my bread and butter is I want to be seeing those 12, 14-year-olders for comp treatment. And we don't get those right away. You got to kind of build that up. In my practice, Dr. Steve's been here for 30 years. And as I was saying, he sees a lot of patients right up to 18. He does class 2 fillings. He does stainless steel crowns when necessary. So he's seeing these older patients, but a lot of pediatric dentists don't do that. So that would be the first thing, is knowing that in the beginning, the pediatric dentist is going to be doing a lot of the work and the orthodontist isn't going to be doing so much. And I think the second thing is you guys have to be seeing eye to eye. Pediatric dentists and orthodontists can make significantly different amounts of money, and so you can't have jealousy there. You've got to have something that's fair for both of you, because the pediatric dentist is working really hard, seeing these screaming, crying kids, and they're referring to you, and then they see you going, oh, you're the hero, you're just straightening the teeth, you don't have any of that stuff going on. So you got to make sure you both see eye to eye, and that's something that Dr. Steve and I do. We're about growing our practices and giving great patient experiences. So that's a major thing too. All right, so yes, we do see a lot of adolescent patients, and I've got well over 1,000 kids that we're watching. So we see a lot of kids and we just watch them. One of the things that when I do have to treat a young kid that has helped is a scanner, no question about it. Impressions, kids don't like them. Nobody likes impressions, right? So let's say we need a lower lingual holding arch and the kid is 7 years old and they've already lost some baby teeth and we're starting to get some crowding. Well, if you go in there with that impression, kids don't love it. They're already scared. You may not even get your impression. Kids are already scared. They come back for their next appointment. It doesn't work. So we get the scan. The scan makes the appointment easy, but it also builds trust. So it's a win-win there. And then we go to deliver the appliance. We rarely have any issues. So that's the thing that I think has benefited us the most. Okay, so we have a practice that's very diverse, and we need to order a lot of different things. Okay, so we need to order brackets, we need to order wires, we need to order bands, we need to order eyelets, we need to order all these different things, and we want to try to condense that to make it the easiest for us as possible. You've got an assistant who is doing all the ordering, and they need to be assisting also, so they need to be able to focus on their job. And so ordering can be an afterthought. And so we want to make it as easy as possible. So G&H, we use them, and they sell just about everything. So I try to order about everything through them. And it's at a good cost too, so that makes sense for us. The advantage of relying on fewer suppliers is that you don't need to spend as much time ordering things. You're not always having to look at what's missing, what's not. With G&H currently, we have a program where they send us quarterly bracket shipments, and that's very good for us right now because we're seeing patients, I think, across the board, nationwide, numbers coming into our ortho offices are going up. And so we've got to be able to keep up with the amount of brackets that we're having, the amount of wires. So G&H has kind of done some algorithms for us to see how much we're ordering here or there and what things we need a lot. And so they just send us quarterly shipments. And that's very helpful for us, so we don't have to constantly be sitting there, we need this, we need that. And then we can just focus on the few things that we don't order as much, such as like a low torque bracket or a high torque bracket. And then we can go from there. G&H makes their own wires. They make their own brackets, they do their own bands, they do their own elastics, they do their own elastomers. So everything's right there. And not only that, now we can start to customize certain things for us. They make our elastics, and we even have our logo on that, and that's really cool. It doesn't cost anything extra. And not only that, it's free marketing at schools, things like that. Kids bring their elastics to school. It says TK Orthodontics on it, so that's awesome. So we like the one-stop shopping, kind of like we are here at our office, Pediatric and Ortho, and that's very helpful for us. I think you've got to first try brackets out and see what you like in a bracket. But for me, there's a few things I really like about it. I use the 022 MBT G&H Mini Prevail brackets. Things a bracket should do: it should bond well, it shouldn't deform. I've had a lot of brackets that deform on me, maybe not heat treated well enough, and then when it comes time to finishing, you can't do what you want with it. I want a bracket that has the proper tip torque in it and that does that on a consistent basis. I like to have brackets that I can customize for hooks, things like that. I also want brackets that I have multiple choices for. So I like to use high torque brackets from time to time where you got those central incisors set back and the lateral incisors are forward, and I can use those high torques in just a couple appointments. Everything looks right with the torque, the gum line looks great. Sometimes we use low torque brackets, and G&H provides that all for us. Just like with their wires, I can customize my wires. They make wires for everybody out there. So I'm able to use certain wires that help me work more efficiently versus companies that only have a few options and maybe things are a little bit cheaper, but the quality is better with the G&H, or you have just more choices to make things more efficient. What excites me about orthodontics? Couple things. First off, I love coming to work. I love seeing my team. I enjoy my day at work. So just purely coming to work, talking with the staff, having a great time in clinic, getting to listen to 80s music at the clinic. I got a great staff and I got great patients and parents. I enjoy talking with my patients and parents. I love getting to know new people. And I know that sounds cliche, but truly every time you get to meet a family, it's a blessing. It really is that you get to be part of their life. And hopefully it's a blessing for them that I get to be part of their life. And then the second thing is I love great finishes. Of course, we all like to have that patient who, cries when we're done because they're so impressed with what we do. But you're making changes in people's lives, and you are making changes in your community if you choose to practice that way, in terms of trying to involve yourself with everybody. So that's what I love the most about it. I also like that orthodontics is a puzzle, and when you've got a difficult case where it's a chest match and you're moving those teeth around and then things look great at the end, you've got that occlusion socked right in, that's something I really enjoy too. Well, I'd like to say that I can predict the future of orthodontics, but I can't. You've got a lot of changes with clear aligners coming along. You've got the DIY companies. You've got companies that are trying to just offer straight up aligners in a brick and mortar office. You also have the DSOs coming in. It's definitely changing. But in the end, we're tooth movers, and we also make people feel great. And I think we forget about that, about how we make people feel great. And so I don't know if things will ever change that much. Braces is still braces. The vast majority of my patients need braces. They're not going to wear their clear aligners. I try to talk people into wearing clear aligners quite often, and they don't want to. I do my share of them, but it's just not a major part of my practice. So I think regardless of what the future holds, if you can be a good clinician and really integrate yourself into the community, be a good boss, things like that, you can really have a great practice regardless of how things change in the future.